Day zero is the moment before company formation, when a founder decides to take the plunge, follow their dream, and commit to pursuing their vision of change. On day zero, you'll hear founders tell their story. From the initial idea, through reactions by critics and skeptics, setbacks and successes, we'll cover it all. Behind every company is a founder with ambition, goals, dreams, and wisdom to be shared. Let's explore them together.
Hi, everyone. Laura Veroneau, managing partner with Optum Ventures here, and thrilled to invite you into another session here with my friend here, the one and only Brad Smith.
Well, thanks so much for having me, Laura.
Of course, and thank you for taking the time. At Optum Ventures, we are very privileged to have worked with Brad for the last few years, first with a company called CareBridge, who has had a lot of success at this point in the LTSS space, and more recently with a company called Main Street, focused on serving rural populations. If you can't tell by my excitement of having Brad with me today, I will just say more clearly, it has been an absolute honor working with Brad Smith, and we feel very lucky to be partnered with you in multiple different ways, Brad. So to get into it, why start with Brad for the first interview that I've done here as an advisory council member? And the short answer is, Brad, I have never quite met anybody like you. And I'll speak to the audience a bit here to explain what I mean by that. Brad is visionary and execution oriented. He is, very, very logical and rational, and always a problem solver and partnership minded person. You have success across any sort of measure across multiple spheres, yet probably one of the most humble people I've ever met. And I think most importantly, you genuinely care about the impact of what you're doing. So at OV, we like to say a Brad Smith company or a Brad Smith like founder is a category in itself. So what I want to do today is spend most of the 30 minutes here, unpacking you, Brad, and your journey as a leader, because I think there's just so much to be learned from you. And I myself am excited to hear your answers to a lot of these different questions here. So I've heard you say before that the last place you expected to be was in front of entrepreneurs and probably investors talking about a company that you founded, at this point, companies. But here we are again. So where I'd like to start is just asking you to please tell us a bit about your journey and how you got here today.
Yeah, well, it's been a really windy and fun road. When I got out of college, my first job was literally being a driver for somebody who was running for the U.S. Senate. So I drove like 140,000 miles in like a year or two. And, after that, I ended up being literally like an executive assistant to somebody for like a year, and then eventually ended up starting an education nonprofit and then going to work for the governor in Tennessee doing economic development. So really a lot of things outside of healthcare. And what got me interested in healthcare was my brother. He was trained to become a palliative care physician. He had taken a year off from school to work with Atul Gawande on a book called Being Mortal. He was kind of one of the research assistants on it. And just he started talking to me about palliative care. And I'd always been interested in healthcare and education policy and those kind of areas, but never really thought about the business of healthcare. And as he started talking to me about palliative care, it just became clear that maybe there was a need there. And then what happened probably like 3 months later is my grandmom got really sick, and I live in Nashville. She was in Knoxville, and I was driving over, 3.5 hours to see her. And long story short, she ended up going in and out of the hospital a few times, ended up passing away without ever going to hospice. And it made me really interested in kind of my brother's idea even more. And so I actually went back to Bill Frist, who I'd met through this education nonprofit I had run. He'd chaired the board, and kind of pitched him on the idea of starting Aspire. And I would just say kind of the whole path has never been one that I've expected, whether it was going to DC or whether it was starting the company. It's just kind of at different moments, kind of different doors have opened, and like the only logical thing has been to do is to walk through it. And so we'll kind of see how it plays out, but it's definitely been an interesting path.
Yeah, definitely. So maybe to pick up on some of those threads and focus on maybe you a bit first, and then getting into the different steps here and some questions on the different paths and stages along the way. I think you talked through some of the different roles: the public sector, the private sector, the Economic and Community Development Office, Aspire, obviously a role at CMMI and now Russell Street. I think all of those areas on the surface may be very different and different in terms of where they're focused and the spaces that they're in, but seemingly from an outside perspective have sort of a common thread in sort of service of others. And often it seems like a very big focus on toughest problems, maybe most complex areas when we think about what you've been going after in a lot of these different pieces. I think for me, from an observational perspective, I think, and I said this a little bit before, something unique about you is that you don't seem to be driven or focused on just finding the largest opportunity area and running after that in a given moment in time. You do really seem to be focused on finding the most challenging areas that you are probably uniquely positioned to solve and solving those problems. And the care seems to be very focused first on, above everything else, solving the actual problem that you identify. So my question for you is sort of what, throughout all of those different paths, what makes you tick? What inspires you and gets you excited to go after all of these different challenging areas, toughest problems in healthcare now? And what about the path and the different roles and things like that have contributed to that?
I mean, I think the biggest driver, honestly, is probably my faith, probably more than anything else. And it just, makes me think that, really the purpose is to be here and try to make the biggest difference you can, kind of whatever way that looks. And my wife and I are very different. She's very good at kind of impacting one person at a time in her life, which I'm not particularly good at, actually, but I like kind of building things. And for me, that's kind of been the journey, right? Is kind of looking for opportunities where you can really, kind of use your skills to make a difference. And I think, some of those early doors that opened were in politics and things like that. Like the way I got the driver job, which was a great job. It was for a guy running for the U.S. Senate. I got to spend, just tons of time listening to him and learning. It was really from somebody I knew from my hometown whose brother happened to be this guy's roommate in college. It's just one of those things you could never kind of imagine.
Yeah.
And I think, as I kind of got farther along, like my brother being interested in palliative care, my grandma getting sick, the fact that I knew Bill Frist, again, those are just like a set of circumstances that almost like all those things had to be true to kind of like create that opportunity. And so I think my real way I've thought about it has just been kind of seeing what door kind of opens up. And as those doors open, kind of trying to run through them well. And I think, tackling the hardest problem, I think is fun. It's challenging, but it also honestly creates a lot of opportunity. And I think you're able to draw a lot of people into those endeavors to run after them. And so while in some ways it's hard, I think this is actually an analogy that Bob Corker, who was my first boss, used. He said, if you go to a football game and you just like run it up the middle every time, nobody wants to come to the game. But if you're trying to throw a Hail Mary every time, everybody wants to come watch. And I think just like the more aggressive you are and like the bigger things you go for, the more likely it is that people kind of want to be a part of that. And so it's actually kind of worked out okay.
I relate to that as a former 3-point shooter. Much more fun to watch, in my opinion, than some of the more, let's say, forward-led basketball approaches. So I like that one. And I think it's helpful as we think about, I assume a lot of people in the audience are entrepreneurs or even people sort of early in their career. And I think that orientation around seeing the opportunities for what they are in the moment and knowing that later they might make much more sense in terms of the pieces and the string of pearls that you've yourself put together over the career makes much more sense looking backwards sometimes than in the moment of running at the different opportunities. So that's great. Okay, so moving from here, now I want to go a little bit through the career and the different steps and how you kind of approach different things at different points in time. So let's go back to the early days of the career, as you just mentioned. First time probably on the public side, broadly speaking, and moving to the private sector, starting as a driver, as you mentioned, for Bob Corker, and then ultimately working in the state's Economic and Community Development Office before starting Aspire. I think many of those early jobs there might not be a traditional path for an entrepreneur, but many people would probably look at these roles as non-traditional for a healthcare entrepreneur. If you rewind, how did you come to the decision? You mentioned some of the pieces that led you towards the thesis of Aspire, but how did you come to the decision to actually jump from where you were and start Aspire and make that leap? And anything about those sort of non-traditional settings that led you to feel confident in making that leap?
Yeah, I'd say maybe like a couple of things. So, part of it was I've always been kind of a little not wanting to go down the path everybody else is going down. So I'd done a summer at McKinsey. I had an offer to go back to McKinsey. I deferred it literally 3 years in a row. And then they were like, you can't defer it anymore. So part of it, that was as I was doing all the government stuff. And part of it was I just had this decision point of kind of, do I want to go down, this kind of traditional kind of safe path, or do I want to do something a little bit different? And I think kind of two things drove kind of the desire to do something different. One was I really did have a lot of great mentors. Bill Frist was one of them. There's another guy, Bill Hagerty, who's now actually in the U.S. Senate, who's been my boss doing the economic development. And they all really encouraged me to kind of take like a bigger risk. And I'm not sure without that kind of encouragement that I would have ever made that leap necessarily. And I would say the other thing that they both said to me, and I think turned out to be true, is that there's a lot of things that are different about running a company than being in government or nonprofits, but there's also some important things that are similar. And I would say, one of the most similar things is both in government and nonprofits and campaigns. It's all about kind of building a group of people and rallying them around kind of some cause. And at, a campaign, it's obviously around kind of ideological causes and getting people to, vote for you and things like that. In a nonprofit, we started a nonprofit around education. So you're building a board, you're raising money, you're like recruiting a team in. And in a very similar way, starting a company is almost the same thing, right? You got to go out and find customers, you got to recruit the team, you have to find investors. So I would say that idea of kind of bringing people together and rallying them around something was similar across those. Obviously, in some ways, I think the business bottom line is a little bit more straightforward than some of the nonprofit, political kind of bottom lines of what you're aiming for. But I think that idea of bringing people together ended up being really helpful. And the things I'd seen people do in campaigns and in nonprofits and in government, I think was kind of a leverageable skill set, probably more so than I honestly anticipated going into it.
Yeah, makes a lot of sense when you explain it that way. And maybe as you think about leadership in that context, you just described sort of the expertise and building of skills around rallying people around a cause. When you thought about stepping into that sort of from the outside, again, arguably first clear, big leadership role in running Aspire, how did you in that moment think about your own leadership style and sort of what you wanted to be as a leader? And maybe more broadly, how do you think about, how would you describe your leadership style today and how it maybe looked at that time period, and how you thought about even getting started and rallying that team around you as the CEO in that first step with Aspire? And
I think it's honestly changed and evolved a lot. I think, when I was doing Aspire, my first goal honestly was not to fail, right? And so, everything that we did, I ran, super, super hard at. And I think if you, talk to the folks from Aspire, they would hopefully, appreciate kind of how hard we ran at everything. But it was also kind of like a tireless pace, right? Because I couldn't tell the difference between what was like the most important and what was kind of important. So I just ran hard at everything, literally.
I relate to that.
And yeah, exactly. And so, things would happen like, the org we had wouldn't work because we'd be getting bigger. And I would think it was like this crisis moment when it turns out like that's what always happens, but you just don't know any of those things. And so I think, Aspire, I like to describe as we kind of got through it with like, a lack of sleep and grittiness, basically. We just kind of like powered our way through it. And I think as we're doing these new companies, we still have a lot of those elements, but we have a little bit more, insight around, what are the things that there are in these startups? Like certain things have to be perfect, right? Like certain things do have to be A+, and knowing what those things are and focusing on them. But that doesn't mean every single thing has to be A+, at least right at the start. And I think figuring out how to prioritize and keep the team focused has been like a big evolution. And I also think, honestly, figuring out how to delegate was like a big challenge for me, right? The story I've told a couple of times is there was this week at Aspire where we had this big RFP due. And so literally, me and this guy was like my chief of staff, we stayed up to like 3 a.m. one night and literally almost the entire night, the second night, to write this like 100-page RFP. And after that, the next day, I had a call with a national health plan to pitch them. And I was just like exhausted. And it was this moment where I realized, wow, if I keep like literally, I'm working as hard as one can possibly work. And if I don't change what I'm doing, I'm going to run this thing into the ground. And it was almost like you had to hit that barrier to realize, okay, there has to be a different way to organize things. And I definitely don't think we're perfect, and we're still learning a lot as we're doing the second and third companies now. But it's definitely evolved a lot, I think, as you kind of live through those things and realize, wow, there's different ways to do this that might be a little bit, I don't want to say any of it's easy, but at least a little bit more reasonable, maybe.
Definitely. And I think a lot of founders or a lot of folks looking at the early stage companies in my seat are obviously often focused on the team and the team building and the importance on that side. What is your philosophy on, if you're running a company, how you think about building a team around yourself that complements you and can achieve the type of success that you've achieved?
I mean, I'd say a couple of things we've learned. I mean, number one, the thing that we always sign people up for is we really want people who want to be successful and want to win, right? And our plan is to, build really great things, and people have to be willing to have the drive and make some of the sacrifices that it takes to be able to do that. And I think that's always the first thing we screen for. And there's a lot of people who, for really good reasons, that's not like what they want to do. And that's like completely fine. And there's lots of great places for them to go. It just happens like one of our companies that's growing real fast is not the right fit, And so I think that's always like the first screen. I think the second screen, which was not a screen at Aspire, but we've I think been able to do with the new companies, is we're really screening really hard for cultural fit. And I think we're now at a place where, knock on wood, recruiting's gone pretty well. And so I think we're able to say, hey, not only are these people that like we know if there's a hill, like we're all going to take it together and everybody's going to work really hard to do that. But that we like working with because we do work hard, and I think that's been another screen. And then I think the last thing you said about how people complement each other, we've got several people that have been in several of our companies together, and none of us are perfect. We all have good and bads, but we've learned how to work together and how to complement each other. And I think as we're bringing lots of new people onto that, it's the same thing. I think you can't expect people to be perfect. Some people will be more diverse in what they can do well than others, but lots of people have strengths and also weaknesses, and figuring out how to put people in the right roles where they can be successful and shine, I think is a part. When I think about like building an executive team, of course you're going to have a CFO and a COO and these other roles, but it's really about like, what are they actually really good at, and how do you put people in the right lane where they can be successful? Because I've learned it's much harder to make somebody good at something that they're not naturally good at than just letting them focus on the thing they're already good at, and then figuring out how to have another person kind of hedge them on the thing they're not as good at.
The fun part for me here, Brad, is that I'm very excited for your answers to all of these questions. So I'm hopeful everybody else is as well, but it's fun to hear how you think about these things in depth. So a lot on the startup space here, a lot on your time at Aspire and how you thought about sort of leadership building and making the jump originally and building the team. Where I want to go next is the next part of the career, thinking about the relationship that you've had over time with the incumbents in the space on the healthcare side. Obviously, with Aspire, you had a phenomenal experience of selling your company to Anthem, one of the largest institutions in the space or incumbents in the space, and got to see that through that lens. You've partnered over time, both in previous life and with your current companies, with a lot of folks across the entire landscape in a really differentiated way that I think is hard for many folks to understand how to do that and how to think about that and how to think about the role of innovation on the incumbent side. the landscape as well. So I kind of want to move into that incumbent sphere here. And as someone who sold to an incumbent, partners with a lot of incumbents, and held a role inside of one before moving on from there, how do you think about the role of incumbents in innovation, and what is your approach to thinking about that part of the ecosystem, given how healthcare works overall?
I mean, I think when you kind of look at the healthcare space, whether it's on the payer side or on the provider side, the reality of the system we're in is you just have some really big players on both of those sides, right? And the payers tend to have national footprints. A lot of the providers tend to have more local but very dense footprints. And I think if you're going to kind of innovate in this space, you kind of have to accept kind of how the landscape looks today. It doesn't mean you can't try to disrupt those massively, but that's very hard. What I've kind of found, and this is probably more on the payer side, but probably true on the provider side too, is that people understand the healthcare world is evolving a lot and is changing a lot. And whether that's, Amazon buying One Medical and saying there's new entrants coming in, whether that's the payers moving into service businesses, what CVS is doing on retail, like everybody understands the world is kind of moving, and they're trying to, the incumbents, find their place in that world, right? What I've also seen kind of being inside of some of these places is the places where, large organizations can really add value are combining things together, leveraging their scale, but starting something from scratch and really innovating from that very early phase. It's not to say it's impossible, but it's not very easy, and it's kind of antithetical, honestly, to kind of some of the structures they put in place to make other kinds of decisions that are really important for them. And I think, all of the incumbents, or at least a lot of them, have recognized this at different levels, and so have teams of different levels of maturity starting to try to think about how do we find partners, or how do we invest in things, or how do we kind of create that outside pipeline. And I think, we found a lot of success in partnering with those folks. And honestly, you guys, and I tell this to people at all the plans, honestly, is that I think what you guys have figured out both at UHC, at Optum, and at Optum Ventures is kind of like the best in class version of that, where, one, on like the plan and services side, separate from OV, you guys have figured out how your health plans and your services units integrate probably more closely. Lots of other people, Anthem, CVS, others are trying to solve for that, but I think you guys are farther along in that maturity cycle. And I think you guys are also farther along in thinking about how your venture groups worked, and how do you integrate kind of the investments that you're seeing and the needs you're seeing in your business with kind of investments in early stage companies, and then being able to sell them into as customers into kind of the plans or the Optum side. And I think you guys are really sophisticated at that. And what we've seen is that, if we can take these really big but very discrete problems where there's not really a solution today, and kind of build a solution, whether it's around rural healthcare, around HCBS. These are things that in general the plans know are important, but they're not going to be on their top 3 or 5 list. And in both cases, you need something pretty early stage because nobody's built out the solution. And I think it just makes these really rich partnerships where, for us, we're getting access to being able to scale, and access to capital, and access to partnerships in a way that allow us to grow the businesses faster than we otherwise could have. And hopefully for those folks, they're getting a way to solve some problems that, maybe eventually they will insource somehow or build out a solution or whatever it looks like. But they're kind of seeing what's happening and what's working, and they're able to kind of test things out, or at least watch things being tested out in a way that'd be very hard for them to do, from an innovation perspective. And so I think it's ended up being these really symbiotic relationships. It doesn't mean that some of these startups can't go against the incumbent in a more direct way, and maybe some of them will have success. But I think at least the path you've picked, and the path I encourage folks to think about, is like this kind of partnership path, because I think it really is a 1 + 1 makes 3 kind of thing.
Yeah. I think we could spend probably 2 hours talking about your approach and your success on the sort of incumbent or institutional partnership side, but it has been unbelievable to watch how you go about that, and honestly requires a deep understanding of the complexity of the system today and why it is there to even frankly identify the opportunities like the things you're going after. I think I've said before, and will say again, I don't think anybody else knows enough about LTSS or HCBS to even know that there's an opportunity there, never mind to even think about how to begin solving that problem. So yeah, what you have done is a model in itself in terms of that large scale innovation. So just an interesting area to hear you talk about. think from here, you obviously jumped back into the government. We're moving into the lovely time period of 2020, which was probably very different than you maybe originally thought. So want to jump back into that time period one more time. So you take a jump into the public sector again. You've just started as the new director of CMMI, 10th year of CMMI, if I have my facts correct. And you probably had all kinds of ideas on continuing progress of past folks like Adam and Patrick and others. And then the pandemic hits. Just for fun, can you talk us through what those first 6 months in Washington were like for you?
Yeah, well, the first 2 and the last 4 were very different. So, I went up in January of 2020, and the first thing Alex and Seema, who was running HHS and Seema was running CMS, asked me to work on was, as you mentioned, CMI was 10 years in. It spent about, depending on how you count it, $10 to $15 billion on kind of all these pilots across the country. And they kept saying, hey, we get all these like one-off reports about how they're going and they don't look that good, but we don't really know how to like add them all up. And can you kind of like organize it basically? So we went back through and literally in the first 2 months I was there, went through these 54 models, all the reports to kind of see how had things gone over the last decade. And we can get into it more, but the short answer was it hadn't gone that well. And so, started to kind of build a plan with Seema and Alex for kind of what we might do about that. And in the middle, I was realizing all my colleagues were getting distracted by this COVID thing. And I was, I think, like literally one of the few people in January and February at HHS who was not working on COVID. And what happened is there was this day in early March, people remember this, but where like the stock market came down like 10 points literally in one day. The president gave a big speech, lots of questions about kind of what was the strategy. And kind of at that point, Jared Kushner, who was over in the White House, ended up getting more involved in the COVID response. And when that happened, he knew Adam. He called Adam. Adam called me. Anyway, long story short, early March, I ended up going over to the White House the day they called me. And I called my wife on the way and said, I'm not really sure what's happening, but I'm either going to be here for like, a few hours and I'll be home for dinner. Like I'm going to be here for a really long time. And I'm not really sure which one it is. And anyway, it was, really early in the crisis. And I ended up getting pulled into kind of this team that was working out of the West Wing, and really kind of the way that they used me was really for setting up kind of solutions for things that the government hadn't done before. And then as those things got set up, I would kind of hand them over to people in the government and move on to the next thing. So in those very early days, I don't know if you remember this, but like there was this lack of testing everywhere, right? And we didn't know if it was spreading because we hadn't done any tests. And so, literally the first like 3 days I worked on COVID, which sounds like not that long, but it felt like forever.
Very long,
was figuring out how to set up these testing sites. And so we ended up like looking at South Korea was running testing sites. And so we were literally like reading newspaper articles. Then we found people to call over there and just understand how were they running them. And then we kind of built this model for how you could run a drive-through testing site, which was something the federal government had never done, honestly. We went out to this parking lot in like Arlington and like modeled it out and all that kind of stuff. And then we launched a bunch of them literally within like 3 or 4 days. And as we did that, I kind of turned it over to this division within HHS that ran that. But like in the middle of that, what we realized is you needed swabs to, do the test and everything. And there was this strategic national stockpile, which, we just assumed, I think, had lots of supplies in it. And, day 2 or 3, I finally got the list of what was in it. And then you realize, wow, there's like, 1 million swabs for like the whole country in this, in this thing. And so we immediately realized that there were a lot of supply issues. And as soon as we started, calling around, we realized that everybody was calling around and that there was kind of not enough supply in the country. And through that, we came up with this idea because a lot of things were getting shipped over on boats and it takes like 30 days to come over on a boat. We came with this idea to like fly a bunch of stuff over on airplanes, basically. And so we got all the approvals for that. And then we got some of the DOD guys to kind of execute against that. And so anyway, the long story short is it was kind of this moving between different fires, for lack of a better word, and kind of getting a new thing that the government hadn't done set up. And then figuring out how to hand it over to the part of the government that could really do it on a recurring basis. Because the government, especially the military folks, after you have like a clear plan, they are extraordinarily good at executing it. And so it kind of ended up being this like nice symbiosis really between kind of entrepreneurs willing to come up with new things and kind of push the boundaries a little bit, and then really good executors who could then take an idea and just go stamp it out over and over and do it at scale.
Yeah. I mean, a super interesting time to be in a government seat and seeing the sort of partnership and innovation that happened between both sides. So maybe with that lens and with that seat, how do you broadly think about sort of that government-led innovation and how that ties into the private sector? What did that role sort of evolve? Obviously, you had the public sector role before, but did that evolve anything in terms of how you thought about the government's role in a lot of this broad innovation?
I mean, I would say the way I think about kind of what we learned in the COVID response about that and what we learned in the CMMI work are slightly different, right? So I think in terms of like a pandemic or crisis response, I think, for outlier events like that definitely happen, but happen infrequently, right? The government has like a really important role to play in planning for those and helping on executing the response. I think, what's unique about America, and there's lots of other countries like this too, but one of the things that's unique about America is our private sector is really strong, right? And when you get into things like how do you develop a vaccine or how do you distribute tests or these kind of things, the answer is like, you have to use the private sector. There's like literally no other answer you could pick. There's not a government agency that really can, build or develop vaccines, or that can, the military has some trucks to do distribution, but we use mostly FedEx and UPS, right? And so I think you just realize that there has to be in kind of a crisis in the US, this symbiotic response between the private sector and the government, because neither of them can do it by themselves and they have to work together. I would say, what's a little bit different about the CMMI work is, that was really where the government was trying to step in and drive innovation and change by changing how things got paid for. And I think the learnings there were really interesting. And I think the government has an important role to play. But if you look at kind of what the effect has been so far of the CMMI work, I think it kind of indicates where the government can be effective and not. So when we went back and looked at these 54 models, what we saw is that 5 of them had saved money, and most of them hadn't. And so you say, okay, by whatever standards we had for CMMI, it was probably to do 3 things. I think probably change how people got paid, improve quality, and reduce cost. Mm-hmm. It definitely changed how people got paid, right? In every single model, we were changed. So it was very successful on that front. The quality findings were mixed, I would say. And the cost findings were probably, if you net it all out, negative, right? It probably lost several $1 billion, if not like $10 billion or more potentially, right? Depending on how you calculate it. And I think you say, well, why did that happen? And I think what happened is because the government has to kind of respond to all the stakeholders, right? They decided, probably appropriately, to make the models voluntary. And, although there's a lot of ways it looked, the way they basically got people to participate in voluntary models was by paying them more than they would otherwise get paid. And there were a lot of ways that kind of got described. It was a care coordination payment. It was setting like a favorable benchmark. It was doing all these things. But the effect of it was we were basically paying people more. And what all the analyses showed is that while there would be some kind of gross savings, like utilization would come down a little bit, when you weighed in what we were paying people, it was almost always negative net savings. And when I kind of took that approach or finding, I guess, to Alex and Seema, I said, hey, here's kind of what it looks like. What I said is, I believe that CMMI can save money over time, but it's very, very hard because they have to make difficult decisions. They have to make models mandatory, or they have to set harder benchmarks and things like that. They make it harder for people to honestly make money on the programs. And I said, while it's pretty straightforward how you do that, the political will to do that is very, very hard. And so I think it's based on that very hard for the government to innovate in a meaningful way around these things. Yeah. And I think where the government can be much more effective is in one of 2 strategies. Either one, looking at innovations that are happening in the private sector, let them get proven out there, and then the government really be the person who's responsible for scaling them up. And so look, if all the MA plans or the private plans are doing certain things and they're saving money, then maybe the government should look at that for traditional Medicare. But I don't know that the government needs to be the first one kind of testing out new things for lots of reasons. I'd say the second thing that I think works probably best is when the government lays out the goals of what needs to be accomplished and then allows the private sector to build solutions to address those goals. And I think this is what you see happening in Medicare Advantage. This is what happens in managed Medicaid. And I think that's a much better role for the government to play than really trying to pick winners and directly seed innovation. Because I think the story at CMMI is that, in my opinion, that really hasn't been successful when we've tried to do it, even with like really smart, good people leading it and a lot of political will to try to make it happen.
I think we're almost at time here. So to wrap, we've covered your path in many different ways. We've covered the startup landscape. We've covered the incumbent landscape and some perspectives there. And then obviously just going through more of the government side of the equation. But now we find you obviously transitioning back to Nashville with your beautiful family. And at this point, focused on Russell Street and a lot of, like I said before, very hard problems and a lot of intentional focus around solving those problems with a little bit of a different angle. So would love to sort of wrap with maybe a two-part question. I'll hit you with the first part first. Just tell us about this next chapter and how you landed on exactly what you're going to do and some of the problems that you're going to solve.
Yeah, for sure. So moved back to Nashville after the government and, really wanted to start a couple, maybe when I came back, I thought 3 or 4, it might be more like 2 or 3, companies that could run after really hard problems. And so, we kind of looked, especially in the Medicaid and Medicare, we also looked in commercial space a little bit. And we kind of said, hey, where are there big kind of thorny problems that seem complicated? That not a lot of people are running after that we can, build a business model around. And so, so far we've kind of found 2 of those. We got a third one that we're kind of baking on. But the first one was this company called CareBridge. It, as we've referenced a couple of times, takes full risk on patients receiving home and community-based services. This is a part of the Medicaid program. It's about 2% of the Medicaid patients across the country, but it's about 20% of the Medicaid spend across the country and continuing to grow. And there we've really kind of built out this innovative solution that leverages the fact that the program pays for this typically non-clinical caregiver to be in the home. And so we both work to make sure that caregiver and the other supports in the home are the right levels of support to keep that member as independent as possible in the home. And then we deploy, tablets to the home to be able to leverage that caregiver as the front line of an interdisciplinary clinical team. So it's cheaper than, like, for example, our Aspire model, but then able to bring a lot of those same resources to bear kind of through that caregiver and through the family members that are in the home. A second company we built is called Main Street, which is a rural primary care company. We're going out to like little towns. This is from driving the 140,000 miles, right, where my family is from. But, going out and partnering with these little doctor practices of, 1 doc or 2 NPs kind of things, and then helping them move into value-based care, starting with Medicare Advantage. But we're just launching in traditional Medicare. We plan to go into commercial Medicaid over time. And just finding a huge need in that space. We started last year in 9 counties in West Tennessee. We're going to like 11 states this year. And I just say it's been, amazing kind of the take up we've seen from doctors there. Our goal, I don't think I've even told you this yet, but our goal was to have about 42,000 MA patients. And, we're definitely going to be north of 100 and maybe like 125 or even 150, depending how some things land. And so I think it just speaks to kind of like the need that there was and the desire there was for this kind of solution. And then we got one more idea we're working on. But I think the common theme to them all is like running after these, expensive, unique, kind of complicated, underserved populations. And one of the other best pieces of advice I got was from Annie Lamott, which was, it's way easier to build an innovative solution in a space where you're the first or second person than when you're the 5th person. And I think, in every space we've gone into, we've tried to be first or second. And I think that just creates a little bit more room to run and figure things out along the way.
And it truly does feel like your team is uniquely positioned to solve every problem that you go after, which is probably a decent part of the success that you've had so far. So to wrap, recognizing we still have a long way to go towards the real sort of better healthcare system we all envision in the future, where would you like to see us collectively in 5 to 10 years? And where do you see yourself in 5 to 10 years in this as well?
Yeah, I have no idea where I see myself, but I mean, when I think about like the system that we want to, work towards, like I think about three things, right? So one, there's been, fantastic medical innovation in the country that's, I think, extended life expectancies and helped a lot of people live healthier and better lives, right? And so I think number one, you want to keep the United States at kind of the forefront of that innovation and driving those, true therapeutic and other kinds of innovations, right? I think two, it is a lot of the chronic conditions in the country and kind of the general health of the population is, burdensome both on individuals, but also on the system. It is very hard to move those kind of things, but I think that's got to be at kind of the national level, something we're at least thinking about. And then I think the third part is, the cost is just really high. And I think so far we have, not shown that we really have any great ideas for how to lower that cost in a meaningful way. And I think that there's got to be a lot of work on that in a way that doesn't sacrifice the first two things I mentioned. And I think that's where I'd love to spend more of my time, whether it's, doing it with some of these smaller specific populations like we're doing in the business context or, in a government nonprofit context. But I think this cost question is still out there. And I don't think that the idea that value-based care as it stands today is going to solve that. I don't think that's going to be the solution. So the question is kind of how do you get there? And I do think there are things around competition and the private sector and all these kind of things that do create an alternative path forward that maybe has a higher chance of success, but hopefully get a chance to help run some of that down in the future in some way.
Okay. Well, that kind of wraps it. So I think I want to say thank you, Brad. I think in other areas, other arenas, let's say sports or something like that, we've used that a few times. It's much easier, in my opinion, to get insight into leadership and different people's paths and how they approach problems and have achieved success over time. I think that's actually incredibly hard to get at scale in the business world. And so incredibly grateful for you sharing your insights and what has been so far already an unbelievable journey for your career and letting all of us learn from that and for taking some time with us because we know you have a lot going on. So thank you, Brad. And we'll wrap there.
Yeah, thanks so much for having me.